There is growing optimism more Canadians could get vaccinated sooner than originally expected. With more provinces moving to extend the time between the first and second doses and the prospect of more vaccines being approved, every Canadian who wants one might get one before the end of September. There is still a long way to go, though. Right now, more than 1.6 million Canadians have received at least one dose. That works out to just over 4% of the population, and just over 550,000 people are now fully vaccinated with 2 doses. Delaying the second dose by 4 months will mean more Canadians get at least some protection with 1 dose sooner. Michael Couteur explains what more we know about those shifting timelines.
We expect that our timelines will be reduced overall.
Ontario's health minister believes more people will be able to get their first vaccine sooner than originally expected. Federal officials had set September as the target time for when every Canadian could get at least 1 dose of the COVID-19 vaccine. But new guidance from the National Vaccine Advisory Panel suggesting a longer lag time between doses means more people could be protected earlier.
We would be able to cover the vast majority of the Canadian population, or the same population, in a advanced timeline, or moving it up by several weeks.
When pressed, Dr. New refused to be more precise, but one Atlantic premier already has a date circled on the calendar.
We should be able to get every Nova Scotian their first dose by the end of June.
Saskatchewan is looking at the same time frame. Now, the accelerated timeline is also being helped by increased delivery of vaccines. It's expected Canada will get 769,000 doses of the Pfizer-BioNTech vaccine per week for the first 2 weeks of April. And 1.3 million doses of the Moderna shot are coming in the next 2 weeks. Still, premiers complain it hasn't been quick enough.
I do not think it's acceptable that Canada is 44th in the world in per capita administration of COVID-19 vaccines. I think it's an embarrassment.
A part of that could be due to vaccine hesitancy, which is a problem in every country. And officials know it's an uphill battle when there are changes to guidelines, like for the time between doses.
Definitely the messaging would be simpler if we had one set of data and we had one message and it never changed, but that's not what science does.
People have to understand science is an evolving thing. What is true today may be altered tomorrow when we learn something more.
Now, Health Canada says approval of the single-dose Johnson & Johnson vaccine should be coming within the next week. However, delivery of those shots may only start in April at the earliest. Donna?
Okay, Michael Couture in Ottawa tonight. Thanks.